Welcome to another edition of COVID Conversations. I'm Adam Gaub. We're here with Assistant Health Director Brittain Kenney, and Britton's going to be talking to us a little bit today. First about just kind of an update on where we are with some of the COVID metrics, and then talking about the Pfizer pediatric vaccine. And Brittain, we're continuing to see some really good trends in the right direction.
We are continuing to see all of our metrics decline, which is exactly what we thought we'd see and had hoped to see for so long. And so we're really encouraged that those continue to go down. Last week, our daily case count was 31 on average.
Wow.
If you remember, just a few weeks ago, it was in the hundreds and
Right.
close to 200 some days or more. So seeing that continue to go down every week is great. We were probably most excited to see our number of deaths go down so significantly. The week before, we had seen 12 deaths, and the week before that, it was 14 deaths. We only had 3 deaths last week.
That's awesome.
Yeah, it was great news. We knew that would come down once our cases started coming down, but to actually see that, that's just something great for all of us to see here. All our work's paying off.
And obviously with the case counts coming down, you're starting to see hospitalizations come down too, and just kind of that burden on the hospital is starting to be relieved a little bit.
Yes, absolutely. So those were down to about 28 per day last week. And if you remember, we had well over 100 for a long time in our hospital. So that just means that hospitals are, having less work to do to manage all of their COVID patients and can get back to their business as usual too.
So with all the numbers heading in the right direction, the obvious message here is that we don't have to worry about COVID ever again, and that we can just, obviously we can just rip the masks off, everything's done, don't have to we can gather with hundreds of people at our home in Thanksgiving and not worry about a thing, right?
I know a lot of people would like to hear that, but you know how it is. It's something we're going to continue to monitor. We're going to continue to let the public know what's going on. That way, if we do see numbers start to go up, if we see that same holiday surge, we can let the community know so they can continue practicing those same things we've all gotten really good at practicing, getting tested if they're sick, wearing a mask around others, definitely getting that booster if they need it. All things we should do anyway, but if we see those numbers start to turn around, then we can kind of alert the public and let them know they need to be on top of it.
And the health department was putting out some messaging just a couple weeks ago with Halloween on the horizon in terms of best ways to stay safe with trick-or-treating and just kind of good practices for that. And obviously with Thanksgiving kind of right around the corner now, amazingly enough, and Christmas not too far away.
Right.
Again, it's just kind of those same, you don't want to say common sense, but things that we've now grown accustomed to in terms of best practices when you're talking about these holiday gatherings.
Exactly, and we've got a lot of tools at our disposal. We know there are some in our community who are still not ready to get vaccinated. We've got testing centers that are a great resource for them. They can get tested before they're gathering with any family members who are unvaccinated or if they're not vaccinated themselves. Same thing with masking or moving outdoors. These are all strategies that are going to help us wherever we fall and whatever we're comfortable with.
So one of the big pieces of news over the past few days has been the approval of the pediatric vaccine, and we've started to see private care providers, whether it's StarMed or some of the others that are starting to offer vaccine, and now the health department's getting ready to roll out appointments for vaccines there, right?
Absolutely. So this Wednesday, we will roll out our COVID vaccination clinic for peds. So the 5 to 11 group will have their own special clinic. It'll be staffed with people who are comfortable working with that age group. As you know, giving a 5-year-old a vaccine is very different than giving a 50-year-old a vaccine. Sometimes. Now
they might act the same.
That's right. Sometimes they're the same, but we just want to make sure that experience is really comfortable for the children and their families when they're coming in, because we know this is a big decision and that parents have done a lot of question asking on the front end, and we want to make sure it goes really smoothly. So we will start this Wednesday by appointment. We are encouraging folks to get an appointment, which they can do either on our website, Gaston Saves, or we have the link at the top of our Facebook page on a post as well. The appointments will be in the afternoon, running from about 1 to 4:15 daily, and we have them out for a couple of weeks, and we'll keep adding them in there.
So trying to make it convenient for parents, either take your kid right after they get out of school, or maybe just pick them up a little bit early and take them over. So.
Exactly. Yeah, we know these children were out of school a lot last year. We want them to be in school as much as possible, so we're not doing morning appointments right now. But luckily, we've got a ton of vendors here, as you mentioned, who've started appointments. So a lot of pediatricians' offices, our partner StarMed, who has the daily site over behind the jail from 10 to 4 every day, that's drive-through. that's not for every child, but for some of the older children, that actually might be a really great option. They don't even have to get out of the car. They can just do the vaccination right there.
Well, in StarMed, I mean, they've been really going out and using social media to spread the word. I saw it over the weekend in Charlotte. They partnered with somebody to offer like ice cream cones and stuff at one of their clinics. So, I mean, they're really trying to make it as fun as you can make getting a shot for kids.
Yeah, maybe I should go there if they're giving out ice cream. That
Right?
sounds pretty good.
Right. That's for a lot of kids, it's like, all right, the reward is right there.
Right.
It's like, all right, if I just hold still.
I will for sure be bribing my 3 children when they get theirs. They're actually really excited about getting it, and have had a little bit of competition with their classmates about who could get it first. So they were disappointed that they weren't in that first wave last week, but they're coming this week, and they're excited.
Yeah, my daughter got hers late last week, and that was, when she got the flu shot the year previous, she was definitely, kind of not thrilled about that, and not a fan of needles, as most people are not. But this year we just went through. We were having her kind of count backwards, and just something to kind of keep her mind off of it, and it went really smoothly. I mean, she was excited to get it. And it's just, as a parent, it's a relief knowing that, for younger kids, masking and social distancing have been the only tools for them to protect them. And now we finally got the opportunity to be able to vaccinate them as well.
Right. I'm right there with you. I remember the first hug that my children gave their grandparents after the grandparents had gotten vaccinated. And then with what we saw with the Delta, with people still getting infected even when they were vaccinated, they had a lot of protection, but this just is another layer of protection for our minds, especially over the holidays. So yeah, a huge relief to us as well.
I know there's been some questions initially when there was some conversation about how many doses the state was giving out, and I think the health department got 1,200 doses initially. That's not the be-all, end-all for what you guys are getting, right? Right,
absolutely not. No, that was just our first order. So, if we were somehow able to run through all those in a week, which would be great, we're ready to do it, we'll be able to put in another order and keep them coming. There has been no indication that there's going to be any shortage of vaccine availability. And as you know, too, we've got many partners who've ordered vaccines as well for the community. Right. We know that our Caramont pediatric practices are getting ready to start offering that. Our Atrium and other pediatric practices, and a lot of our pharmacies have put in their own orders.
Just in terms of you being a parent and making preparations to get your own kids vaccinated, what was kind of the decision-making process on your end in terms of the information that convinced you, this is safe, this is the right thing to do?
So luckily, being in the field and working in public health, I have a lot of access to good information. And so we're hearing it all the time, and we're learning how to talk to other people about it. But I will tell you, all 3 of my children went in for flu shots in September. And so when we talked to their pediatrician then, I kind of asked those same questions that other people would be asking their pediatrician. One of the questions I had was my children, at least one of them, and probably all of them, had COVID. Fairly recently. So I wanted to know, should we wait to get vaccinated? Is there anything, any benefit to doing it now versus later? And so talked through that with our pediatrician, and he was very encouraging about that there'd been plenty of time between their infection and now, and to go ahead and get vaccinated. And actually, if other parents are in that same boat, it gives them an extra boost if they have that natural immunity, and now they're going to have that vaccination on top of it. So they're going to be really protected this winter.
Well, and this is something that there's been a lot of conversation that we've seen kind of out on social media where people are saying, it's like, oh, well, it seems like the vaccine affects people worse if they're older or have comorbidities. Why should I worry about getting my kids vaccinated? And I think you mentioned earlier, you talking about the Delta variant, the ability to get it and then spread it. I mean, if not for getting it for your kids to keep them from getting sick or long COVID, potentially from giving it to somebody else, right?
Absolutely. And so it was all of those things. So it was making sure we could protect other members of our family who are older or might be immune compromised. Sort of selfishly, I need to keep my kids in school. They missed way too much school. I don't want them out because they're either infected or a contact, and that vaccine's going to give us another tool to keep them in school. And then thirdly, I have had friends with very healthy children whose kids got really sick. And, some of them have said it's the sickest they've seen their children. And, most of them are okay. 99% of the time they're going to be fine. But just in the back of my head as a mom, I want to make sure that my kids aren't some of those who are really, really sick from COVID.
Well, and I think that's the worst feeling in the world as a parent is having your kids get sick and feeling like you're helpless to do anything about it.
Right.
So anything I can do to avoid that, sign me up.
Exactly. Same here.
Anything else about kind of the process and what people can look forward to? I mean, obviously when we were, as the county, rolling out mass vaccination clinics at the very beginning of this year, which seems like years ago, but 10, 11 months ago,
Right.
there was a huge demand. There was, people trying to get reservations. Do you anticipate kind of the same sort of rush for the kids, or do you think it's going to be fairly easy for people to make those appointments?
From what we're seeing, it's been very easy to get appointments. Now, if you want your appointment tomorrow at 8:15, you might have to do a little bit of shopping around. But for sure, if you want your child vaccinated right away, there are dozens, hundreds of appointments available in this area and around our area in the coming weeks. So I don't think we'll see that same rush or inability to meet the demand that we saw before. And we're ready, if there is a huge push and we need to step it up, we're ready to do some community vaccinations. We're ready to work with the schools. There's a lot of other conversations going on about that.
Awesome. And then for next week's COVID Conversations, we're tentatively scheduled to talk to one of the nurses that is actually going to be working in the vaccine clinic for children, right?
Yes, I'm excited for you to meet her and talk to her. She is an expert around vaccinations and can make adults and children alike have probably the best vaccination experience they've ever had. And I don't just say that lightly. She is good at what she does. So I'm happy for her to be here and talk with you.
Awesome. Well, we're looking forward to it. Brittain, thanks so much for joining us, and thanks so much for tuning in to this week's COVID Conversations.